Okay, so today is October the 12th. Going forward, if you look here, it says Socrative.com, S-O-C-R, SOCRATIVE.com. That is where we'll take our quizzes. All right, we'll take our quizzes on that. I usually quiz every Friday, so that's just where you'll go, and whether you're at home or you're here, you'll log in, you'll take a quiz. They're not particularly easy. You have to learn how to take notes as a college freshman. There are going to be things that you think that aren't important, and those are the things that you're going to be tested over, I promise you. So things that your professor is talking about, you want to write down any little minuscule thing, but that's where it goes. All right, so today we're going to talk about how healthcare touches your life. We're just going to go over careers a little bit, how things work. All right, stop and look around. Chances are you have been to the doctor, dentist lately. Your grandmother may have recently stayed in the hospital. New developments in biotechnology may have affected the food you eat or breakfast, okay? So we'll go from nursing to biotechnology, those type of things, all right? The worlds of science. There are many opportunities within the world of health science. Interested students need to have a solid background in math and science, as well as communication, technical and teamwork skills. The reason why I have you guys write so much is because in the hospital you need to be able to write. Okay? You need to be able to write. Okay? You need to be able to write notes or type notes rather these days. You need to be able to type notes, and you need to be able to type them where the next person can understand your notes. Okay? You'll have a different language you're using sometimes in healthcare. You'll have your medical terminology words, but then you'll have your regular English at the same time. So if you're not good in math or science, especially math, you probably want to get good, or you probably want to get you a tutor, okay? Because math is definitely part of it, okay? All right. Education and training can be obtained in high schools now, okay? When I was growing up, I'm kind of old. So when I was growing up, we didn't have patient care technician. We didn't have welding. We didn't have these things. We had wood shop. You want to learn how to make stuff out of wood, but we didn't have that in high school, okay? We didn't have the opportunities you guys have, all right? Community colleges, universities, and technical schools. Through the training programs, learners gain knowledge and skills that lead to workplace learning experiences like a job, shadowing, and internships, okay? The health science career cluster has divided into 5 career pathways. Pathways are grouped by common knowledge and skills required for occupations in these career fields. Each pathway provides instruction, basis, et cetera, okay? Therapeutic services, okay? So these are your 5 pathways, right? Therapeutic services, that would be you, okay? Therapeutic services. Health information. Health information is going to be your people that are doing healthcare records, keeping things correct with HIPAA, all those type of things. All right. Biotechnology, research and development. Biotechnology is research. The people that do research, that are looking for coronavirus vaccines. People that are looking for these things, they are those people. All right. Diagnostic services. Diagnostic services will be X-rays. You go to the lab, you're getting your blood laboratory work done, you're getting your blood work done. What is it? A person that takes your blood? Phlebotomy. No, I didn't. No, you can't move it at all. I'm telling you, you can't move it out. Because I turned those lights off. Those lights, heat lamps. Yeah, it was hot in here. Me and my girl over here, we sitting here doing this. Yeah. Support services. Support services is something, support services it could be dietary, it could be any of those things, okay? All right. So, I always put careers to things in this perspective. The perspective is, what kind of life do you want to live? That's it. It's what kind of life you want to live. Do you want to live in a $500,000 house, or you want to live in a $100,000 house? Makes me know, never mind. Okay? But it's what you want to do. Okay? It's what you want to do. All right? Health science is the largest, fastest growing industry in the United States. That may not be so true right now. I think IT may be fastly catching up. All right. Healthcare industry and employees are over 10 million workers in more than 200 careers. Okay. Therapeutic services. Careers in therapeutic services are primarily focused on changing health status of a patient over time. Over time being, over time being the operative word, meaning the most important word, over time. Okay? Over time. Health professionals work directly with patients and may provide care, treatment, counseling, and health education information. Okay? So that is going to be your physical therapist, occupational therapy, sometimes respiratory. We work in ERs and on the floor, so it may not be overtime in the ER. But a dramatic change is probably going to be overtime. Okay? So there's your therapeutic services, and those are the examples that I'm giving you. Okay? Just make sure you remember the examples. Always in my class, if you write something down, if you learn something, make sure you know what an example is, because trust me, it's going to be on a quiz. An example is going to be on the quiz, and it's going to be worded in a way that may or may not confuse you. But as long as you know what the example is, you should be fine. Okay? All right. Diagnostic services. Careers and diagnostic services used to test and elevations that aid in detection, diagnosis, and treatment of disease, injuries, and physical condition. Okay? Diagnostic services. MRIs. Okay? Some of you may get to school and decide, I know Midwestern, they have a pretty good X-ray technology department. They do, MRIs, things of that nature. But remember, when you're picking out these jobs, these jobs are only in one spot. You know what I mean? It's not like you can move around. You can't move around, anything like that. So, I mean, if we're in a hospital and we need 6 X-ray technologists in the hospital, that's all we need is 6. So you go to another hospital, all they need is 6. So jobs are not as plentiful as they would be in nursing or something like that, because you need people in nursing everywhere. Okay? All right, so diagnostic services. Okay? Health information. Okay? Medical records. Health information pathway offers a wide range of career opportunities. Career range of health care administrators who may manage health care. Oh, by the way, if you go to college, don't go into, you go into what you want. But healthcare administration majors, most healthcare administration people are clinical people that went into administration. So they went and got a PT degree. They went and got a nursing degree. They went and got a respiratory degree. And then they said, okay, I'm going to go back and get whatever administration certificate I need so I can move into healthcare administration. You just don't become a healthcare man because you didn't learn from the bottom, if you will. Okay? You didn't learn from the bottom. Your mother can tell you much more about you than I can, right? Because your mother had you at birth and she's had you, right? So I can't come in and tell you about the hospital and I just got here. You know what I mean? If you were a nurse or a therapist and you've been working in hospitals, not necessarily that hospital, but you've been working in hospitals for quite some time, you know. It's like you worked in the hospital. Right, you can teach, right, because I know I've worked in several areas, so I'm fine, so that's kind of the way that goes. All right. Financial information, computer application are related to healthcare processes and procedure. Okay. So this is going to be like an intake girl when you first get there. What's your insurance? How you going to pay? You're You got any other ailments? That's going to be that first person. This person is going to be, of course, the person that's at the desk. She may be a telemetry tech. This person, those are all entry-level jobs in the hospital, which they're good to have because they're a good way for you to find out what you like and what you don't like. Okay, so those are good to have. Support services. Careers and support services provide therapeutic environment for the delivery of healthcare. Career opportunities range from entry level to management, including technical and professional career. Okay, support services, maintenance, biotechnology, anything in IT. I know I have a friend. She works for Baylor, I think, or one of these companies, but she's in healthcare. But she's on the computer side. She makes a ton of money. She works on the computer side. She makes a ton of money. So to be in healthcare doesn't necessarily mean you have to be dealing with blood or in guts. It can be different. Okay. Biotechnology and research. Careers in biotechnology and research develop pathways involve bioscience research and development as it applies to human health. These are scientists who study disease, discover new treatments, invent medical devices, or improve the accuracy of diagnostic testing. Okay, to me, these are kind of really the introvert type people. They don't really want to deal with public and people being sick. They rather sit in a room and do research and figure out how I can make your job easier or how I can make your job more efficient or better. Really smart people, really smart people. They know math really well. They know math and science really well. So, if you want to go into biotechnology or research and development, if you can invent something that makes healthcare run smoother, you can make a lot of money. A lot of money. So again, I go back to, how do you want to live your life? That's it. How you want to live your life. Okay, these are all the things here. All right, the future of healthcare will bring better healthcare and outstanding employment opportunities. Okay, all right, that's it.